start in this lateral position because our patient's already in the lateral position. The difference is going to be, though, is our IR orientation. What is our IR orientation for the lateral ankle? It's lengthwise, okay? We have to include the distal third of the tibia fibula. So we're gonna turn this. I'm gonna lift this up a little bit. I'm gonna set this underneath here, and we are centering where for this?
Perpendicular to the IR directed at the MTP joint in question.
I'm about to say.
Medial malleolus for the lateral ankle.
Medial.
So the medial malleolus is this little bone, the little protrusion that you can feel on the medial side of your ankle. So you're going to center that to your IR. Center the long axis of your tib fib with your IR. Have her dorsiflex her foot if she can. Can you dorsiflex a little bit more? There you go. Okay, center to that IR. I'm going to move towards you just a little bit. Okay, what SID do we have? 40. So I'm going to double check that. We're still good there. Okay, marker is going to come anterior. And we're going to collimate once we get this lined up. I'm going to open this just to make sure that my collimation matches my IR placement. Okay. Then I'm going to close it down. Distal third of the tib fib included. I've got a little light past her calcaneus. Collimate down to include the proximal metatarsals, and I've got light posteriorly. Okay. Now, one of the positioning things that we need to look at here is that we need to have the dorsal portion of her foot perpendicular to the IR, again, just like we did with her lateral foot. So this may change our centering, but let's check. So if we look at her foot, her dorsal surface of her foot is a little bit slanted. So I'm going to bring her knee up just a little bit. Ooh, not quite that much. Bring your knee down, John. There you go. Okay, so I adjusted her foot just a little bit. Okay, she doesn't have any OID here. Her ankle's still on the IR. And I'm going to check my centering. I'm still centered right on that medial malleolus. So I'm okay there. Okay, so everything's checked off our boxes. She's shielded. What are her breathing instructions?
Don't move, hold still.
Yeah, her instructions are to just hold still. Okay. So for the AAP projection of the ankle, our patient's going to be sitting or supine on the table with their leg fully extended this time. So go ahead and straight out. Good. Okay, align the long axis of the foot with the long axis of the IR with our ankle centered in the middle. So I am going to have you lift up just a tiny bit. Okay. Okay. Now, we do still want to have her dorsiflex. Okay. So her foot needs to make a 90-degree angle from her tib up to her foot. So if you can, dorsiflex back. Perfect. Good job. Make sure that they don't overflex. Okay. That can close off the joint spaces too. So adjust them to a 90-degree angle. Marker goes on the lateral side. I still have my 40-inch SID. I haven't touched that yet. Okay. Now, where do I center?
Between the malleolus.
Yeah, midway between the malleoli at the ankle joint. Okay. So lateral malleolus, medial malleolus. So I'm midway between that. I'm going to turn my collimator box so that I'm aligned with the long axis of her leg. I'm going to open my collimation a little bit so that I can line up my CR and my IR. I'm going to lift up, straight up. Good. Just going to pull it down because I'm centered here. I just needed to adjust there. Now I can collimate back down. Make sure to include the distal third of the tib fib. Her foot is still at a 90-degree angle here with the bucky, or with the IR. I'm still centered midway between the malleoli. And remember, this is a true AP. So for a true AP, which malleolus is going to be a little more anterior? Yes. Okay, so Sam said medial. I was waiting for other people to answer too. That didn't happen. Okay, so the medial malleolus is going to be a little more anterior on the true AP. Okay, So we kind of rotate their whole leg in until they're nice and straight, perpendicular to the IR. She's still shielded, and then what are her breathing instructions? Hold still. Good.
Rotating it internally.
How much?
15 degrees.
Not 15.
10.
It's not 10.
30 to 40, right?
It's 45 degrees.
What?
Okay, so the 10 to 15
I was
degrees
thinking
was
the
the
other one.
Mortise
Yes.
view. Okay, so you really need to pay attention to that because the Mortise view is and can be a specialty view. So just because they order a Mortise, that they may also want an oblique. So the oblique is a full 45-degree rotation. So you'll start with your patient in the same position that you had them in, dorsiflexed, centered on your IR. And what I do is I actually bring their whole leg out towards me a little bit, and then we're going to internally rotate the whole leg. You're going to feel the condyles on the knee, okay, on the distal tib fib. And you want those to be at a 45-degree angle to the IR. Because remember, the medial and the lateral malleolus do not sit parallel to each other. So you can't feel those to determine your rotation. So you feel the condyles. Okay, so that's about 45 degrees. Her foot is still dorsiflexed. I'm still centered midway between her malleoli. I still have my collimation open to include the distal third of the tib fib. And on this one, you're going to see part of the metatarsals. The marker's still lateral. And I'm still centered on my IR and at a 40-inch SID. Okay. She's shielded, and then what are her breathing instructions? Just to hold still, okay? The important thing with this is, especially this one, is don't let them, when you ask them to rotate in, don't let your patient only rotate their foot, because that will give you that Mortise view, and that's not what you're looking for this oblique. So make sure that they roll their whole leg in, and just like Asia's doing, sometimes you may even have to rotate their whole body a little bit. Okay? Okay.